And it's Carla, your online doctor, with today's Live in 5. Today is Tuesday. It is December 1st, and it is 5 p.m. Okay, so as I read articles written by many physicians in the United States, seeing cases increase in their hospitals, one question that keeps being asked is, why can't you give me fill in the blank, right? Why can't you give me whatever it is that is the latest thing, right? The blank depends on the patient. For some, the blank is replaced with one of the few proven COVID treatments, such as dexamethasone, maybe remdesivir. But for others, actually, most people, the blank is replaced with things that have been in the news a lot. Hydroxychloroquine, don't shoot the messenger, vitamin D, vitamin C, zinc, and melatonin. Okay? In medicine, we talk about risk versus benefit for any given treatment. But COVID makes these calculations a little bit more difficult. The outcomes can be bad, and we really don't have any slam dunk treatments yet, right? So it kind of puts us in a difficult situation as physicians. Now, many people feel if that's the case, we should be allowed to try unproven drugs because what's the harm? Well, many of the treatments people ask about for COVID are low risk. Doctors often fall back on the excuse there are no good randomized trials to show efficacy. But what if they do work and you never try them, right? So let's consider melatonin. It may not work for everyone. It may not work at all for some people, in which case the harm from taking it is kind of small, right? Maybe you get a little bit sleepy, but if it does work, then it may save your life. Okay, all that is wasted by believing in melatonin or zinc or vitamin D is the cost of the pill and some mild side effects at most, right? People opposed to this belief say, well, what if you pick the wrong medicine or the wrong supplement? What if while you're wasting your time treating someone with melatonin or zinc, the other one, okay, let's say you treat with melatonin, maybe zinc is the magic bullet the whole time and you were treating with melatonin and not giving zinc, right? So sure, you could throw the entire kitchen sink at the patient and hope something works. But then what if something counteracts or interacts with another treatment that they're getting? Okay? Clearly the it can't hurt theory works better if you are only trying one thing at a time. Medical doctors in general still look to clinical trials to support their actions. As a doctor myself who strongly believes in the benefits of supplements and natural remedies, this makes me think, why are we always talking about only treatment options? Doesn't prevention come into play? I currently take zinc, I take vitamin D, I take vitamin C, and I take melatonin. And I take other supplements that are recommended for prevention. So I wouldn't be asking, can't you give me that? I would rather be saying, I'm taking all of that now because I'm trying to prevent this thing from getting to me. So if I get sick, maybe it'll be mild, and the doctors will have a very easy time, if I ever need to see a doctor, to help treat me. Okay? So, like I said, I do all the other things. I social distance, I wear a mask, I limit close indoor contact, and I wash my hands. Plus, I eat healthy and I watch my weight and I try to get my as much good sleep as possible. So if you're doing all the things and you're taking the supplements and you're doing things that are helping you prevent, then hopefully your treatment options are going to be much easier and better for you in the event that you should get COVID and get sick, okay? Because I know a lot of people who are doing all the things I'm doing who've gotten it and kind of got through it pretty darn easy. So here's praying that if that's you or me or anybody that you love or I love, that because we're doing all these things, we don't get it too bad. So on that note, I hope you're having a wonderful day, and I will see you again on Thursday for another Live in 5.